Welcome, folks. We'll give everyone a couple minutes to join. For folks that have just joined, we're going to give people another minute probably to get on. All right, we're at 5 past the hour, so let's get started. Welcome everyone to the Disability Organizers Forum. My name is Jessica Lehman. I work as Executive Director of Senior and Disability Action, which is in the San Francisco Bay Area. And I lead the Organizers Forum, which is generally a monthly call designed to expand and support community organizing in disability communities, to provide each other support and share ideas and do some strategizing together on how we can all be more effective. The Organizers Forum is a project of the National Disability Leadership Alliance, which is a cross-disability coalition of organizations working to amplify the disability voice on all kinds of issues. So for folks that are new to the Organizers Forum, we generally do a call every month, and we do a mix of issue-based topics, thinking about not so much what are all the policy details, but how can we do really good organizing around that issue in our own communities, and how can we collaborate to really have an impact. And then we do some on how we're working together and how we are connecting with different groups and what are community organizing skills and strategies that we can share. So please sign up for our listserv, which is disability organizing at googlegroups.com. You can also make a note of that in the chat, and we'll capture it later if you want me to add you. So let's see, a comment on access for today. Thank you to our ASL interpreters, Kat and Norma, who are with us. They should be spotlighted. Of course, if there's any problem, let us know and we'll work to resolve it. We do have captioning. If it is not showing up for you and you would like it to, if you usually on the bottom of your screen, sometimes the corner, if you're on a smartphone or a tablet, you'll see 3 dots that says more, and you can click that and choose show subtitle. And I'm going to ask Shaya. Shaya is our tech person today. Thank you so much, Shaya, for helping us out. If you can put a note on the caption in the chat so people can see it there, that would be great. All right. And guidelines for today, just wanted to share a couple group agreements. I think, one mic, right? One person at a time, especially on Zoom, that can be tricky. I will also say, let's honor collective access. We can all share the responsibility of making sure that all voices are heard and that everyone has a chance to participate in a way that works for them. Also recognizing, particularly on Zoom, sometimes there are conflicting access needs. So I know the chat is great for some and not great for others. If it's not good for you, I will invite you to take a moment, go into your settings next to mute or video and just turn it off. And any information that goes out in the chat, we will be sure to share out loud as well. What else? I would say move up, move back, right? Which I think most people have probably heard. If you're someone who tends to talk a lot, then move back a little bit, right? And make space for other folks. Especially if you are from a group of folks that tends to talk a lot, right? Then think about kind of the demographics and the power balances there. And if you're someone who doesn't tend to talk a lot, if you're from a group that tends to be neglected and not heard, we want to hear your voice. So speak up in whatever way is comfortable for you. And along with that is recognizing the importance of intent and impact, right? So sometimes people say, assume good intentions, and that's important, right? That we know we're all here because we care about these issues, we care about building community, but that's not enough, right? It's also the impact we have on each other. So we'll hold those things today. And I just want to, on that note, share a quick apology and offer accountability for my error last week in sending out the announcement for this call when we only had white speakers confirmed. And obviously we cannot do a call on this topic or any topic without Black, Indigenous, people of color who are also disabled and have disability experience as a key part of that call. So I should not have sent that announcement out, and I thank folks for calling me out on that, and really looking forward to continuing to work with all of you. So today's topic, where's my title here? So today's topic is fighting for care, an intersectional approach to home and community-based services. And this came out of a few months of organizers forum calls that we've had earlier this year, where we were talking about what are the big issues that we need to take on that really affect disabled people and particularly disabled people of color. And how can we fight for these issues in a way that really lifts up the voices that are not heard, in a way that really directly tackles racism and ableism? So on the last call, we all thought this is such a great issue, that there's so much happening right now on the national level, on local and regional levels, and that there's some exciting collaborations happening that are unfortunately not always the norm. So we have 4 incredible speakers with us, but for folks that have been on organizers forum calls, you know that it's really about all of us. And so we'll have them do some talking, and we're going to invite everyone along the way to put questions in the chat or raise your hand if the chat is not accessible to you. If you're on the phone, you can hit *9, by the way, to raise your hand. And then we want to hear from all of you too about your ideas on this topic. So let me introduce our speakers and we'll jump in. And I tend to forget something at the beginning. I'm going to count on somebody reminding me if there's something I should share. Oh, one thing I forgot is that we're on social media, Facebook and Twitter under Organizers Forum. Please help amplify this to people who aren't here today. Share questions and comments, and let's keep this conversation going, because we know 1 hour is not enough. So our speakers for today, we have Malcolm Harris, who's and let me spotlight you, Malcolm. Malcolm is the California Senior Campaign Manager at Caring Across Generations. He focuses on creating a system of care across the lifespan of California's diverse families and communities, linking paid leave, early childcare, and long-term supports and services. He has a background in labor and community organizing. Malcolm is from Oakland and based in South Central LA. And he's been organizing in South Central and California around issues relevant to Californians broadly and Black and Brown Californians specifically around a variety of issues like housing, work, and other things. So welcome, Malcolm. All right, and then I'm going to introduce Natalie Kean. Natalie is Senior Staff Attorney of Federal Health Policy at Justice and Aging. She is based out of Justice and Aging's DC office, where she advocates for federal policies to increase equitable access to healthcare and home and community-based services for low-income seniors. Thanks for being here, Natalie. And Nicole, I just realized I am not totally sure how to pronounce Nicole's last name, so I'm going to let you tell me. Are you there, Nicole?
Nicole, Jorwic.
Nicole Jorwic, thank you so much.
Yeah.
So I think a lot of us know Nicole from her work at the ARC for many years, doing really powerful disability advocacy on the national level. And now she's at Caring Across Generations as the Chief of Advocacy and Campaigns. And she's also the sibling of a person with a disability. And I have to hurry up and let Nicole talk soon because she is joining us from a vacation out of the country and has generously offered some of her time. So we're going to let her speak and jump off. And then last but not least, our other speaker, who I think someone else and I spotlighted at the same time, Nikki Brown Booker, who is full disclosure, a longtime friend of mine, a biracial woman with a disability. She's been active in Hand in Hand, the Domestic Employers Network, and is now the director or the program officer for the Disability Inclusion Fund out of Borealis Philanthropy. Thanks so much for being here, Nikki. All right, so let's jump in. As we said, we're going to let Nicole talk first. Nicole, why don't you give us a little bit of update of what's happening on the federal level so that then we can think about what does it mean for our organizing?
Sure. Thanks so much, and glad to join along with my colleague Malcolm and Natalie, who's a co-chair of the Disability and Aging Collaborative, along with me. So great group, and Nikki we haven't met, but glad to be joining, and always good to be joining Jessica and the rest of everybody. Obviously, or maybe I shouldn't say obviously, but the push for home and community-based services has been for the last 26 months, a really important focus of the disability community, and also and we've been working together with aging groups as well as labor to make sure that our asks are combined and strong, and that has led to some success with short-term funding, but now we're pushing for the $150 billion for home and community-based services. That would both expand access to services, so it includes things like making personal care attendant services a mandatory service, so that everybody would get at least something. And then it also has really important components around raising wages for the direct care workforce. And where we are right now is we need a train to be moving in order to get attached. And that's because this is all part of what used to be called Build Back Better. So if you've heard about Build Back Better, I'm sure you all have. It's not that it's dead, it's that it's called something different. Right now, what it is still to be determined, but if you hear things like economic recovery or budget reconciliation, that is really, that's what we're talking about. And the reason that that's happening is because that only requires a simple majority in the Senate. And so, but that is all up in the air at the moment because we have to make sure that Senate Democrats move a package. I will say that if a package does move, home and community-based services, because of all the great organizing and advocacy that has been going on, is really well situated. There's a real understanding about the savings of home and community-based services, and how much unpaid care is going on because of the lack of access to services. So I would say that home and community-based services, the $150 billion, is well placed. It's more that we need to make sure that we're continuing to keep the pressure on and reminding folks that we're watching, and that if they don't deliver, that they're going to have the disability community to answer to, as well as the rest of the collaborators. I just want to name that I recognize that care can be a complicated term for a lot of folks and a lot of disabled folks. It's just that's a term that a lot of folks understand. And so I just would be remiss not to say that, but glad that that's kind of the impetus of the call, because it really has been beneficial, because we have to make sure that we're getting folks in the disability community, but also folks outside of the disability community engaged in order to get this investment, and frankly, also to get what's next. We're going to need to push for more, because unfortunately, $150 billion isn't going to fix every problem that we have in the HCBS system, because of decades of lack of investment in both the workforce and services. So I just talked a lot, so I will stop. But I will be able to stay for a few more minutes. So happy to answer any questions and be part of the conversation. And I will definitely make sure to watch the recording after I'm back from vacation to check out the conversation that I missed, because I am really excited about this conversation. And I know I've learned a lot working with Malcolm for the last 6 months at Carrying Across, and have been really lucky. And so glad that he's here and that you all can learn from him too. And I'll turn it back over to you, Jessica, and I'll stay on for a few more minutes if anything comes up.
Thanks so much, Nicole. That was a really helpful overview. And I'm glad you brought up that care can be a complicated term. I'm wondering if Nikki will speak a little bit about this, because I know in hand, we've had a lot of conversations about what do we use, and particularly when we're thinking about bringing disabled people. And I think Nicole kind of got at like people who identify as disabled, along with people who may not identify as disabled, but also with workers and other groups. How do we think about the words we use?
Thanks, Jessica. This is Nikki speaking. I am a light-skinned Black woman wearing glasses. I have a brown and white dress on with a white shirt, and over the top of the shirt, and I have short curly brown hair. So I just wanted to say, I think when it comes to the term care, I think for a lot of people, care sometimes feels like kind of patronizing, and like that it like makes you seem like somehow you're not able to provide your own care, or that you somehow, the implication is that you need someone to take care of you, right? So but I think that what we're really trying to say is that care is really about interdependence, and that we should be about caring for each other, and not just caring, not just that it's a care towards somebody who the implication is that they are less able to provide care for themselves. So, and I also feel like another issue is that sometimes, depending on your age or your particular situation, that that you don't want to feel like somehow you are less than or unable to do something. So I think that, and I feel like that word care has a lot of implications behind it. But like I said, I also feel like it's about interdependence, and that we should be caring for each other, caring for our children, caring for our seniors, caring for whoever it is that we have relationships with, and that we have relationships not only with ourselves but with our community.
Nikki, just to follow up on that, this hadn't occurred to me in this way before, but do you see the fight for home and community-based services in, like, given what you're saying about thinking about care, do you see it as having the potential to also transform people within disability communities about how we think about this?
It's a really good point that you bring up. I mean, I feel like, sometimes we don't want to think about the fact that people with disabilities don't want to feel like that they need people to care for them. But to me, it's not about that. It's about, like, when I have relationships with my providers, my care providers, my attendants, I try to, find ways to care for them as they find ways to care for me, right? It's all about that term interdependence. So I feel like, it's actually not just a shift culturally, but it's actually kind of a shift, like internally to be thinking about that in different ways.
That's really great. Thank you. And Nicole puts in the chat, we all need care. All right, so let me ask a broader question, and Malcolm or Natalie, feel free to jump in. How can we fight for home and community-based services in a way that lifts up the importance of all the people involved, disabled people, older people, women, immigrants, et cetera?
I can come in behind Natalie, or do you want me to jump in?
Sure, I can start. This is Natalie. So this has been something that, has, I know, taken a lot of background work, but as Nicole mentioned, we've built this coalition of disability, aging, and workers advocates at the national level to really fight for this in the moment. And it's made all the difference in the world. For the first time, we're hearing the President of the United States talk about HCBS, make it part of his platform. He often calls it elder care or home care, but it's we know he's talking about HCBS. Again, the terminology matters, but we're getting there, and we've made so much progress. So I think working together and understanding that we have more in common to win than differences in how we might go about that is super important. And really, in this moment right now, we're facing such a workforce crisis in HCBS and such strain on family caregivers, especially in communities of color, that we can't solve the problem. We can't increase access to HCBS without supporting the workforce, growing it, making sure that they have good pay, training, making those quality jobs. So I think building on what Nikki was saying about care and interdependence, I really feel like this fight is one that can only be won if we are working together and thinking about each other.
Thanks, Natalie. Could you repeat the question one more time, Jessica? I just want to make sure that I got it right.
Sure. And you don't have to answer this exactly, but the question was, how can we fight for home and community-based services in a way that lifts up the importance of all the people and all the groups involved?
Perfect, thank you. Should I describe myself? I realize I didn't do it earlier. So Malcolm Harris, I am a Black man, medium skin tone, wearing glasses with short, kind of medium length curly hair. And again, I'm with Caring Across Generations. I am the California campaign manager for our statewide care campaign. I think just to piggyback off of what Natalie said, I think there's two things. I think one is not only growing the workforce, but growing the workforce in a way that takes into consideration, especially when you look at IHSS jobs and who's applying or who does those jobs, that there's overrepresentation of Black and Brown, meaning Spanish speaking folks in those jobs, mostly because of the high levels of unemployment and underemployment that are happening across the state of California and really across the nation. So I think that growing the workforce and fighting for expansion of those wages that a lot and the benefits and looking at strategic ways to enhance those are critical, especially when you talk about equity and equity for Black and Brown communities in particular. And then I think the second thing connected to home and community-based services is actually finding out who's missing at the table. One of the things that we're noticing as we're building out our statewide campaign is that Black and Native communities tend not to be at the table organizing around Black and Native community issues. And although there seems to be representation of other communities in a lot of the critical coalition spaces, that Black and Native communities in particular seem to be organizing almost outside and separately. And I think it's critical to figure out why that's happening and the issues that don't bring those folks to the table. So groups like the California Black Women's Health Network, which has a group called SAGE that released a report around California's Master Plan on Aging that was completely separate from any of the long-term supports and services or HCBS organized coalition efforts here in the state. And so trying to figure out and lift up home and community-based services and senior and disability issues in the Black community context, but that's not a part of any of the organized spaces that I'm seeing. And so it's how do we bring those together? How do we create the linkages between those groups? And also how do we have open and honest dialogue around the issues that continue to generation after generation in 2022 have folks missing from the table? So I think that's critical to really kind of dig into and understand. And we've been spending a lot of our time doing that as we've been building out our California campaign. And I hope I answered the question, Jessica.
You definitely did. And you gave me more questions. So I hope that's a good thing. Which is what should or what can disability community organizers be doing in our own communities to make sure that Black, Latinx, Native, other marginalized voices are at the table?
Can I respond to that? I think there's a couple of things that are important about this. One, I mean, speaking from a funder perspective, I think that funders really need to really, buy into the fact that we need to do intersectional work, and that we need to support groups that are doing intersectional work and are really making sure that they have people at the table that are Black and Brown people are being represented across different sectors and different issues. So that's like just from that a funder perspective. But I also think, I remember when we were working on the first California Domestic Worker Bill of Rights, that we really had to, as the disability community, we really had to reach out to other groups. We had to really, make sure that we were speaking to each other and building coalitions and building relationships. I think that was so important to getting that bill passed, is that we actually took the time to build the relationships with other groups, and building those relationships, making sure that the people that were really being affected were at the table, which means that we, are working with the California domestic workers, Broad Coalition, and also with lots of other groups, and making sure that we were speaking to each other, talking to each other, really listening to each other, hearing what each other's issues were, and that was really instrumental in getting that bill passed. So I really feel like that's one of the things that we, if we're gonna really put our money where our mouth is, that we really need to make sure that we have broad representation, that and that we really bring people to the table that we're really that are actually part of our community.
This is Natalie. If I could just add, I think one thing too to keep in mind is that a lot of policy making happens outside of the legislative process too, during implementation of laws and funding, and at the federal level through the Centers for Medicare and Medicaid Services. So just for example, when we do get this $150 billion investment in HCBS, the bill itself hardly says anything about equity, which is not good, but we have an opportunity and an obligation at that point to make sure that people with lived experience, as people of color, are at the table helping make decisions about how that money is used.
I just wanted to add that I think there also needs to be a certain level, and I've been spending a lot of time on this over the last year and a half that I've been with Caring Across Generations. I think I'm hoping that this is going to be a conversation and not just us responding, because I would love to hear from other folks what their ideas are, because I feel like the critical piece that's missing is just the depths of white supremacy and privilege, and the ways that people understand their privilege, even in their disabilities, if that makes sense. And that there also, I think, needs to be real deep self-reflection, critical self-reflection around why this continues to happen, if it's continuing to happen, and how does that internal self-reflection lead to not just bringing folks to the table, but also keeping folks at the table. Because I think that there's a commitment to not just equity, but also to how to maintain equity in a way that builds trust. Because I think that there's some real issues of trust and that have not been worked out completely as I've been seeing them, that I think also need to be addressed, and specifically when it comes to Black and Native communities. And that really needs to take into consideration, why do these things continue to happen over and over again? And how do folks who represent the disability communities make a commitment to long-term equity, not just on paper, but to the folks who should be showing up, if that makes sense.
Thank you for that, Malcolm. I see a couple hands, but I wonder if I can ask you for a follow-up before that. Will you say more about you said the way people understand their privilege, even in terms of disability?
Sure, I'll start this off. So I am a part of the LGBT community, and I was really surprised when I came out of the so-called closet, just the depths of anti-Blackness in LGBT communities, and just the understanding of white skin privilege and not being Black in ways that I see repeated in other communities, including sometimes in the disability communities, and that I've engaged with folks and lifted up, and that there are in some ways repeats of the same system that we all live in within the disability community itself, that maintain kind of like white skin privilege, our non-immigrant privilege, et cetera. That to me, and I hope I'm answering this, that continues to keep the face of who disability advocates and activists are that don't seem to change year after year, at least anecdotally what people are telling me. And that seems like there, as far as I've heard, as I've been engaging with folks, or we've been engaging with folks that kind of maintain a certain level of privilege and entitlement in some ways that keeps certain communities from coming to the table, or once they come to the table, to stay. And that tends to not be white disabled community members. So I'm trying to talk around this lightly, but I think everyone here understands what I'm saying. And it would be great, because I see in the chat that other folks are co-signing on this, if other folks jump in. So let me get off of my box and step back. Hey, Leah, I see you, sister.
Thank you so much, Malcolm. And I just also want to kind of call into the room what Nikki was saying about the fight for the Domestic Workers Bill of Rights. Back in like 2012, 2013, it actually got really messy with people in disability communities. And I think it's fair to say white-led disability rights groups who were really worried that talking about domestic worker rights was going to hurt disabled people, and very much became one group pitted against each other. And it was really painful to see. And so I think that's the kind of thing that we're talking about that I'd love to see us reflect on and explore. So the first hand is from Tom. Tom, go ahead.
Yes, I'm a white-looking elder who have been working in the very in those areas where we don't talk about a lot. And our discussion today, we've talked about some groups, but we haven't got down to the groups that are that don't have a lot of equity. And I'm talking about the people that are coming out that will need health care that we don't go into, and that's we got 50 to 80%, people with disabilities in prisons and jails, and we have to respond to that. And we have 2 million people under guardianship, and actually the word of guardianship means incapacitated, and they are disabled, and we don't work with them. And those are people really wanting to live in a community that we don't, we're not talking about, as well as, the foster care system, which has a lot of people with disabilities. And sometimes if you don't have a disability going into the foster care system, you might come out with one. And then we have, how do we reach the people that are in the nursing homes? How do we reach the person in the group homes? How do we reach the people in the psychiatric hospitals? We can talk about a lot of things, but it goes right down to the very beginning. Who wants to get out into our community? How do we get that person out? And those people are of color, are of, they're the people that don't have anything to get them out with. They don't have the contacts. They don't have. If we're talking, about taking care of each other, well, we're not. That also means taking care of the ones that we don't see, and we don't have. We have in our community, we have ways of doing, getting into those places. Actually, in the independent living center world, we have a fifth core service, which we have a mandate to go into any institution to help anyone to get out, any institution, and yet we don't fight for that. I've been fighting for home and community-based services since we actually got, money follows a person from a street action in DC long ago. I still want everyone to be in that fight. We have to, but we also have to think about those that have those lived stories that we don't hear about or we don't see about. I can go on, but I think you all understand where I'm coming from here.
Thanks so much, Tom. See, Malcolm put up a 100% emoji and said in the chat, yep, we're very clear about that, Tom. That was part of an action we had last week in Sacramento. I'm going to go to Ligia Montano next, also from Senior and Disability Action.
Hi, everybody. So I'm a Latinx woman, brown skin. I don't know. I don't know how to describe myself. Hair down, curly hair down, and I'm wearing a gray top. I was listening and I agree with everybody. And I wanted to ask Malcolm. I heard you about, not having enough people of color. And at the same time, one of the things that worries me is that the tokenism, that happens, that sometimes it feels like in many occasions, and I'm in one of the best organizations ever, right? But in many occasions, I'm the only Latinx in the room, and honestly, feeling awkward sometimes about being in that position and not knowing if my voice will be also heard in that position. So how can we, avoid that tokenism that happens, when we are trying to fight racism and along with other systems of oppression and working together towards a better care.
Thanks, Ligia.
Should I respond directly or wait? I don't want to
Oh,
jump in.
go ahead. Go ahead.
So Ligia, thank you for lifting that up. And it's all the layers of that and the layers of what it means for us as darker skinned folks with histories and cultures and community to be in these spaces, and just the amount of work that and the toll that can take on us is deep. I think I've also shared with you that my family is from a Spanish speaking country too. I am, and all the layers of what it means to show up and be in places. And I would say that instead of you or I being the folks to come up with the solution, that it should be a collective acknowledgement of an issue and a collective solution. And that I would suggest that for those of us who look like us, who sit in these spaces, that we should not be the ones to have to always come up with the solution. That we should be able to work together to come up with a common solution that we are all a part of, because we all live in this system. And so we all have a responsibility to come up with that solution together. It is not the responsibility of one or two people. And I would just like to lift that up because I think for myself, and I see the hearts around the space in the room, that we should not, especially in 2022, have to constantly over and over again hold the responsibility to be the ones to only come up with solutions or to lift up problems. How can we all do this together? So that's what I just place out to all of us as we build forward to how we can come up with a common solution. Let me get off of my box now because Jose has had his hand up.
Thanks, Malcolm. Let's come back to that in a minute. But yes, Jose Hernandez, glad to have you.
How you doing? So many great talking points here. I just want to just talk a little bit. My name is Jose Hernandez. I'm the community organizer for the Consumer Directed Personal Assistance Association of New York State. I'm also a person with a disability. I'm a Spanish man with short hair, wearing a headset with a virtual background of New York City in the background. I have been advocating on a personal level and a professional level for a few years now, and you're right, there's not enough representation of people with disabilities, and especially people with disabilities of color out there. I usually find myself to be the only one in the room. Well, not as much as of late in New York. We are like in the middle of like sort of a little disability rights movement. But we need to change the conversation within politics in general across the United States. For too long, individuals with disabilities and seniors have been kind of treated as burdensome, and kind of left out of the conversation. Even with our home care workers are kind of the bottom of the barrel of all of the home care sector. And in turn, it kind of affects how a person with a disability kind of sees themselves. So if you are someone who hires their own personal care assistant, and it's a constant struggle to keep finding this person to replace the person that left before, then you never really gain the sense of pride or ability to fulfill your own, life, or fulfill your own life, like get a job, go to school, or anything like that. Like, I've mentored someone that he wants to go to high school, but unfortunately, or get his GED. He wants to get his GED, and unfortunately, he can't because he's always constantly battling home care issues. With that being said, I want to just shift a little bit and say, I'll talk a little bit about, the siloing effect. So we have a bunch of different disability rights organizations, and we're all fighting for the same funds. So we never really voicing together and really amplifying each other's message. So let's say home care was the priority this time around. So it's not a priority for the deaf and hard of hearing community, so they don't really join in our battles. So how do we stop saying that? We all fall under the same category and say that, we're all disabled and we all should be helping each other. Like, I always like to say, our voices together are a lot more stronger than apart. A lot stronger together than apart. So. This is my soapbox.
Thanks so much, Jose. I also want to share a couple of comments from the chat. Rami said, and I'm sorry, this is in response to something Malcolm said, it was a while back, but he said, that's real, Malcolm. It's hard for me to have conversations about HCBS with my Mexican immigrant family because there's not an internalized feeling or feeling of entitlement to care from the government. So as far as who will ask for that. And then there was another here, where did it go? Oh, right, sorry, Natalie was agreeing with Jose and says internalized ageism contributes to this as well. And Shaya, please go ahead.
Yeah, I think one thing I think about, so my name is Shaya, I go by they, them pronouns. I work for the Boston Center for Independent Living, and have blue hair, and I'm a white person. And I think, I feel like one thing that I'm thinking about is how developing more skills around connecting with people across difference and standing up against white supremacy, and creating authentic relationships that those aren't skills that people necessarily develop just on their own, or because it would be a good thing to do. And that I wonder about if it is possible to resource some of that work of having skilled facilitators hold different conversations, and just putting energy into that as a focus, that there are. And yeah, I think that there are, I'm sure, I don't feel like I know quite enough about all of the DEI efforts, diversity, equity, and inclusion efforts, and how those have gone in other organizations, and is that stuff worth does it work? But I think, yeah, there's a lot of there's only so much we can do by naming the problem. It's also working, figuring out some of the tactics to address it.
Thanks, Jaya. I can't believe it's already We have 7 minutes left. Before I call on Lindsay Maihong, I'm very glad is here from Hand in Hand. I just want to share one last question for us to think about, which is, given that presumably we're all here because we care about home and community-based services, and there are a lot of different ways to fight for an issue, how do we use that campaign to address racism and ableism and ageism? So I'm just going to put that there to think about. Lindsay, don't feel compelled to answer that directly, but I imagine you probably are anyway. Go ahead.
Can you hear me?
Yeah.
Okay. Good morning, good afternoon. My name's Lindsay E. Maihong. I'm the California director with Hand in Hand, the Domestic Employers Network, and I'm also the facilitator or convener of the Long-Term Services and Supports for All Grassroots Coalition in California. And I see many partners and allies in the room. I just wanted to, I should start with in terms of a physical description or visual description, I'm mixed race, Japanese American and white. I have pink glasses on, silver hoop earrings. I'm wearing a teal and purplish jacket, and I have dark hair that's almost to my shoulders. And I just wanted to really appreciate this conversation. I'm sorry to have missed the first half of it, but I think that these issues are really critical. Our vision is to build a unified coalition that represents and includes all of the stakeholders in our long-term services and support system in California to build towards universal and just LTSS. And that means that we're bringing together providers who are predominantly Latinx and Filipino, and then consumers, both folks with disabilities, elders, and family members of diverse backgrounds. And one of the ways in which, just thinking about strategies and tactics, one of the ways in which we are trying to build unity and reduce tokenism is through, well, authentic relationship building, but also we're going to be doing a training this week, in fact, with our members around the intersections of racism and ableism and how they show up in the care economy or the care sector. So I'd be happy to share that resource with folks. If they're interested, I can put my contact information in the chat. I don't know if Malcolm, you had shared about this, or Lihia, but it's a training that that we're doing in partnership with some of the folks who've spoken here today. And I definitely think that we can be doing campaigns that really lift up all of our voices, that also try to address some of the racism and ableism that do exist within all of us, but also within our movements. The Build Back Better campaign was an opportunity that we worked to collect stories from all of our grassroots partner members and the public, and we made a real effort to lift up stories of both people who are providing home care, whether it's paid or unpaid, as well as those who are on the receiving end, and just to demonstrate how absolutely connected our struggles are. Yeah, so that's a couple of thoughts. Thank you.
Thanks so much, Lindsay. We're glad to have you. And yeah, I see interest in the chat, so please do share that information. And there was another comment in the chat from Rami. Jose, great point about cross-disability solidarity. I see it more and more each day and hope this generation and the coming generation of disability activists work more cross-issue and cross-disability. So unfortunately, we have to close. I want to save a minute for our speakers to share final thoughts. But if folks are interested in doing a follow-up conversation at the June Organizers Forum, which would be the third Tuesday in June, we often try to do two together, so there's some time to to reflect and come back and talk more, please make a note of that in the chat. Just put, yes to continue or something so we can do that. And I want to extend huge thanks to folks who joined and agreed to be speakers today, and to all of our participants. Really appreciate the conversation. And thanks to our interpreters and our captioner, of course. So I want to invite each of the three speakers that we have remaining to share final thoughts on this topic, either the question about how we can use this campaign to address racism and ableism, or anything else you want people to think about. And I'm going to start with Nikki.
Thanks, Jessica. I mean, that's a huge question to answer. But
you can't do it all in 30 seconds, really?
Absolutely not. Yeah. But I mean, I think really the key to doing this is to build relationships with each other and to learn about each other's communities, and what the effects of really not putting the time in and the money in and the work in to get HCBS services for everyone. It's the issue that crosses everybody is affected by needing care and having people in their lives that they may care for. I mean, I have an elderly mom. I have other relatives that are that have this as a concern in their lives, and I want to make sure that everybody gets what they need. I have to jump off, but I'm really thank you for inviting me, and this is a really great conversation.
Thanks so much, Nikki. Natalie, and then Malcolm.
Hey everyone, this is Natalie. I'll just be really quick. Something that has stood out to me during this conversation came to mind is how much work we have to do with Congress on how they view HCBS and who needs care, who is providing care. They're often seeing it through the lens, I think, of older adults, because that's what they themselves are experiencing. But so often they will only talk about people of color as the workforce, and they're not talking about people receiving services being people of color as well and having varied needs. So just yeah, a lot of work to do. I really appreciate hearing from everyone. I learned a lot today. Thank you.
Thanks, Natalie. Malcolm, you get the final word.
All right. So a couple of things I wanted to say that I think part of it is, how do we challenge ourselves in the present to commit to these issues and to continue to commit and placing ourselves in uncomfortable situations. And I think also a commitment to thinking about what HCBS and care looks like. And much appreciation for Tom lifting up the issues of folks who are formerly incarcerated and connections to carceral issues. Last week, a small delegation that was myself, Lindsay, folks from CFILC, and a couple of other orgs went to the Capitol, to Sacramento, and we talked about HCBS, paid leave, and childcare, and the connections to community. And we actually started off that morning as part of a press conference with CURB, the Californians United for Responsible Budgeting, which is a state organization here in California that's looking at how to reimagine care, and with defund the police dollars, how we can look at and expand how we look at care and who's a part of care. So much and so CPS was a part of that conversation, and so much appreciation for Tom to lifting that up, and to continuing to expand what care looks like and who are care recipients and care providers here in our wonderful state of California. Thanks y'all for having me here. Much appreciation.
Thank you, everyone. It looks like there's unanimous agreement that we will continue talking about these issues. So invite all our participants to join us and invite your friends and neighbors and colleagues. Tuesday, June 21st, same time. Thanks again to everyone. Take care and take action. Goodbye.